just wanted to say a few things about the use of psychiatric medications. While I understand that there are certain situations in which these medications can be incredibly valuable, I believe they are vastly overused. And I believe the main reason that we overuse them is that we misunderstand what we're actually trying to do. So we see like a depression as a problem. Now, it can certainly be a problem when someone is going to, hurt themselves or hurt someone else, not take care of someone else, neglect things, miss out on a lot of life. That is a problem, right? But the problem isn't the feeling of the depression. The problem is what leads to that. Now, in most cases, depression I think of as more like depressing, more like a verb. And the reason we experience depression is that we are actively suppressing aspects of ourselves. We're pushing these things down. Now, when we actively suppress ourselves, we're going to feel bad, right? When we have a natural impulse to do something, to act, to make a decision, to change something, and we're suppressing that, we're pushing that down, then we're going to feel bad about that. And we're going to feel like we're being suppressed and pushed down. And that typically is the depression. The more we do that over and over and over again, and we refuse to act out on our natural impulses, the harder it's going to be to actually do things, because we become practiced in pushing these things down. We build structures around it to keep them down and these kinds of things. A lot of our modern medicine says, well, the problem is the feeling of the depression. And if you can just eliminate the feeling and you can act a little bit differently, you can feel differently, then the problem goes away. The problem, I don't believe, is the feeling. The problem, I believe, is the act of suppression that leads to the feeling. So the feeling is just a signal that we're doing something. Right? That's what results. When we suppress ourselves, we feel depressed. Taking a medication so that we don't feel depressed, even though we're suppressing ourselves, can lead us to learn to be somewhat comfortable in a life that we're not living authentically, in a life in which we're not truly living. We're just kind of going through the motions. But now we have this medication that lets us feel okay with half living. There are certain situations in which medications are absolutely necessary. Usually these are things that have more like biological bases for them. Postpartum depression, a real thing. Like, women going through that, the hormones go crazy. Nothing they can do about it. This is not necessarily because they're doing something to create their own depression. Their body is just in turmoil after going through the pregnancy and the birth. Well, a natural situation. Sometimes people have a brain injury or some kind of physiological thing going on, a stroke. There's all kinds of physiological things that can create this. A brain damage, head injury, closed head injuries from trauma, war, explosions, these kinds of things. Absolutely, they can create a situation where they're not actively suppressing themselves. Their brain functions just isn't where it needs to be. In those cases, take medication. You're probably going to need it. Maybe you don't need it forever, right? Maybe you do. But that's not the run-of-the-mill situations in which we're using, antidepressants. Most of the time for that, it's because, we're living in a situation or we're approaching life in a certain way that we don't feel good about. And we are suppressing our natural instincts to act and to do things. And when we do that, we feel bad. Taking the medication to not feel bad about something we're supposed to feel bad about is foolish. Unless you're not ready to make any changes. Unless you don't have access to the kind of supports and guidance that you need in order to make these changes. In those cases, sure, maybe the medication is in order. Certainly, if it'd be better for you to take a medication to address these feelings than to kill yourself, especially if you don't have the resources or you're not ready. You know, then taking the medication can be valuable. But if you have an option, if you have access to support, a good therapist, good family, religious experiences can do this, self-exploration, all these things can help a lot. You can learn to handle your life very differently and make changes. Then you're going to feel less depressed. And that's kind of one of the beauties of therapy is that you don't have to stay in those states. Anxiety is another common one, in which there's a basic level of anxiety just to the existence. I mean, we're finite beings. We're all going to die. We're isolated from one another. We have this fate that we can't really do anything about. We have a guilt from our actions because we can't possibly know the best things all the time, and we're going to do harm. There's a lot of stuff that goes on with this. Our fundamental isolation from one another, right? But trying to medicate the negative feeling away doesn't help us resolve these existential crises. Right? It doesn't help resolve our fear. It just takes the signal away. And the signal is that there's a threat. Right? That's what anxiety says. There's a threat, but we just maybe don't know what it is. If it's fear, then there's a threat and we kind of know what it is and we're afraid of the thing. Anxiety is a threat, but we don't really know where the threat is. Or it could be anywhere. Right? Paul Tillich really talks about this in a very interesting way from an existential Christian perspective in his book, The Courage to Be. Really great book. It's not the easiest read, but it's really, really interesting if you want to get into kind of what the existential anxiety can look like and how faith, authenticity can play a factor in that. It is from a Christian perspective, but I think many people who are not Christian could also value tremendously from looking at the ideas in this book. So then by medicating the signals that come from these situations, we end up a lot of times reducing the imperative to do something about them. We learn to be okay with living life in a way that's not healthy or good for ourselves. But it's okay because we got rid of the signals, right? I think it's much healthier to confront those things, do the work to come out the other side in which you can feel good about your life because you're living in a way that's congruent with who you want and need to be. Doing this work with having a good therapeutic relationship with a therapist, counselor, can be incredibly valuable. But also a religious leader, a priest, an imam, a Buddhist teacher, or whoever it may be, a yoga instructor, a yogi. Those things can be very valuable too. A sponsor in a 12-step program. Right? But doing something to address this, I think usually is far more important than medicating the symptoms and just trying to feel better. That same holds true for ADHD, but I want to talk a little bit more about the crisis and problem of ADHD in a later video. I hope you found this video helpful, and if so, please keep checking the YouTube channel, subscribe if you like, and I hope you find peace and happiness in your day. Thank you.